Let me take you back to when you were about maybe 5 or 6 years old. How would you have handled the coronavirus? Hi, I'm Femi OK. You're watching the home edition of the stream. Our topic today is the mental impact of a global pandemic on youngsters aged between 0 and around 5 years old. If you're in YouTube, tell us about your family, the kids in your family, the kids that you know. How are they managing? Share their stories, share your coping solutions. We really would love to hear from you. And also, before we get the conversation started, we checked in with some of the Stream family kids to see how they're talking about coronavirus. Let's take a look.
Poppy Lister, and I'm 3 years old, and I choose make people sick, and we all have to be careful when we are washing our hands. My name is Jane Morrow, and I'm about to go in first grade, and I'm just playing on the playground and playing with my friends, but I wonder how the animals and the fur made the coronavirus. So first you bring a mask when you go to school, bring sanitizer when you go to school also, and don't touch anything and don't touch your face.
I can definitely hear parents' influence there. Don't touch anything. Hello, guests. Don't touch your face. It is wonderful to have you here on the stream. Jacqueline, hello. Tell everybody who you are.
Yeah. Hello everyone. I'm Jacqueline So, the co-founder and chief executive of Malvern College International here in Asia. So we run international schools for 6 months old to all the way to 18 years old, from preschool to high school. And also I'm a parent of 2 boys. So I would like to bring to the conversation both from educators' perspective as well from a parent's perspective.
Looking forward to that. Fatima, welcome to the stream. Introduce yourself to our international audience.
Hi, everyone. My name is Fatima Faisal. I am the author of The Incredible Docs vs. Billy the Bad Virus. And I'm also a first-year medical student out in Arizona. And so I'm just bringing perspective of how to communicate with your children, such a complex topic, and kind of really dilute it and be able to explain it to the children.
All right, looking forward to those explanations. Hello, Vikram. Welcome back to the stream. Remind everybody who you are.
Hi, everyone. I'm Vikram Patel. I'm a psychiatrist. I'm a professor of global health at Harvard Medical School. But I'm currently actually in my home in India, where I've been locked down since March. I'm in India because I work with a nonprofit organization called Sangath, which works extensively on children and young people's mental health. And I hope to bring some aspects of the science around how this pandemic might be affecting young people's mental health and what we can do about it to this conversation.
Welcome, everybody. Really good to have you. Good to have you YouTubers as well. You can get the conversation started. Vikram, I am just wondering, what do we know so far about the mental impact of the global pandemic on youngsters? What do you understand so far?
Well, the honest truth is actually youngsters have been one community that have been almost completely excluded from all conversations about the pandemic. Most of the science that we know about the effects on the mental health of people has been really focused on adults. And I think this has been one of the greatest problems about the pandemic, is that young people have probably faced the greatest consequences of the policies related to containing the pandemic, even though they're the least likely to be affected directly by the virus. But we know so little about their experiences from their own voices. And it's the absence of their voices which I think has been really problematic.
Jacqueline, your youngsters in your school in Hong Kong, how are they managing? Have you noticed any change in behavior? And of course, Hong Kong experienced COVID-19 before the rest of the world did.
Yes. Actually, the kids probably in Hong Kong has experienced the longest school closure around the world. So we had the school closure from January and all the way for the preschool students. We still haven't got the chance to go back to school. I think the kids actually throughout the process have evolved very, very well. They're probably the first generation of trying to adapt into online or home learning through a lot of Zoom sections and a lot of the in-home resources and information. So in terms of mental health, right, that has been a focus, a very, very key focus for our educators. When we talk to students and the parents, we have trying to kind of send them a lot of different notes telling them how to actually cope with the pandemic. And also we try to call the parents and the students every now and then, try to understand how they are doing at home. And then we actually encourage parents try to engage in private and individual time with the students to ensure their social emotional skill is developed well. And finally, we're actually trying to encourage the parents when it is available every day, try to bring them to the nature and get them to play a little bit outdoor in the park and try to interact with the nature a bit more, because that tend to calm the kids down so that they can actually sing with the environment a lot better, so that they don't feel that they're actually trapped in an indoor area.
Jacqueline, I want to share with our audience something that I never thought I would have seen in my life, which is a bunch of kids in a Zoom
Yes.
meeting doing wake up, shake up. What is happening
Yes.
here?
Yes. So this is of our PE lesson. So great catch. So what we did is we actually get our kids to join in a Zoom section, so that they were all doing some exercise at home, and then we're jumping together, and that exercise will actually they can do it together, and then they feel like they're actually part of the community exercise. That's actually precisely a very important way. Try to actually get the kids to inaction, and that will get them physically more active, and hence their mental will be better, to improve their mental well-being. And the fact that they can actually do this together with a group of other pupils and other and their teachers, that actually bring them into the community, so that they still socially interacting with other people.
Fatima, you noticed that the kids that you work with, that they were struggling with coronavirus, the impact of coronavirus. Can you tell us what you did and the sort of behaviors that you were seeing?
Yeah, of course. So, you know, I wrote this book because I personally believe that, I mean, I agree with Dr. Patel, currently there aren't as many resources out there for children in regards to helping them with mental health. And I vividly remember watching the news one day and just feeling so anxious myself. And I thought to myself, as an adult, I feel this uncertainty and this nervousness. I can only imagine how children are feeling. They're probably feeling, what I'm feeling and that much more. And so I really wanted to create something that would be engaging for children and allow children to understand what's happening. I think a lot of the anxiety that comes for anyone really is when we don't know what's next. We don't know what's happening. And I think that for children, not only are their lives changing, but they don't know why their lives are changing. I think as adults, we have this concept, we know what the pandemic is, we know that there is a virus. And so I think I really wanted to communicate and create something or a resource or a book that would allow children to really understand what's happening, but not scare them in any way.
All right, so The Incredible Docs versus Billy the Bad Virus. We are going to hear about that in about 10 seconds. But Vikram, you were looking quite quizzical as Fatima was talking about writing the book to help kids. What are you thinking? Unpack that thought.
I think it's no. I'm sorry, I was being quizzical. I didn't intend to look quizzical. I was just very impressed. I think that's exactly right. What Fatima describes is a way to communicate with children about the pandemic in a way that doesn't inspire fear, but inspires confidence, inspires courage. I think one of the most interesting stories about the pandemic has been the fact that children are almost completely immune to this virus, almost completely. It's probably safer to do any other activity in your daily life than actually get infected by the virus. But somehow, this extremely important information that they themselves are actually at very, very low risk has not been effectively communicated. And it has to be communicated in a way that is actually developmentally appropriate. And so, what Fatima is doing is exactly right, communicating directly with children through a format that they will appreciate. And I'm sure I haven't read Fatima's book, but I'm looking forward to hearing those initial lines because I'm sure
What
that
a
it's the
build
way
up.
she writes.
And now an excerpt from The Incredible Docs versus Billy the Bad Virus. Fatima, over to you.
We are superheroes, and people call us the Incredible Docs. We need your help on a very important mission. We know things have been a little bit different lately. Well, that's because Billy the Bad Virus is on the loose. Billy the Bad Virus is a dangerous germ. When this bad germ gets on people, he makes them feel icky. He can make them sneeze and cough. He can make them sick with a fever. He can make it hard for them to breathe in and out, and he can make them feel very sleepy.
Thank you,
We want to
Fatima.
get rid
I
of Billy
don't
the
want you
Bad
to
Virus.
blow. I don't want you to blow the ending as a spoiler. We need people to go buy the book. All right. So thank you for that. Very simple language, really friendly, very accessible. This is a good point for me to share the story of Yunus Muhammad. He's a 15-year-old boy. He lives in an orphanage in Baghdad, and he is looking after some of the younger kids. And the younger kids are really scared about COVID-19. Let's have a listen to his story from June of this year.
The coronavirus is spreading all over the world, and we are all scared of the disease. So we decided to rely on ourselves here. Some of us have become barbers, cooks, painters, or musicians. Every day, we take the children to the playing ground so that they don't become depressed. We are doing everything ourselves.
That's amazing. A kid looking after other kids. Jacqueline, we've got lots of comments and ideas on YouTube, and I want to use your experience as an educator to answer some of them. So Anita says, it's really difficult to manage kids at home without any outings for a long time. So when you've got a serious lockdown, what do you do? What would you recommend you with children who are literally climbing the walls?
I think I should still probably set a good routine for the kids. So having a routine at home, even if they are like really locked down every day, just staying totally at home, completely locked down, you still try to get into a timetable. For example, you get up at 7:30 and then you have breakfast, and then from 1 hour you would do certain reading, and then you can do a bit of exercises and free play for a little while, and then you go back to kind of their quiet time on a certain level, and you can do some physical exercise like yoga, jumping, and then some of these physical exercises with them. Then you can do lunch and so on and so forth. So getting to a routine and making them feel that there's a proper time schedule to do things that will actually calm the kids down quite a lot. And then we can then get the kids to actually create a lot of things on their own. For example, we actually had a few days that we didn't really want to go out, and then we just get a lot of cupboards and all these kind of different materials at home, and we try to make a little hut at home to get the two kids together. So some sort of a creative things that they can actually try to do is going to be very helpful. And also we would encourage the kids to do a lot of the Zoom sessions with their friends. So even for the little ones, like 4 years old, they get so excited when they actually see their friends on the Zoom, so they can take photos together.
This is Kirsty, and I want to bring Vikram in here because this has proved to be a major issue with kids around the world. If they don't have access to digital resources, where is their outlet? How can they? Libraries are closed. They may not have a laptop. They may not have a tablet. Vikram, can you speak to that?
Yeah, I think you've hit the nail on the head. This idea that we can move everything digital completely, ignores the fact that a large number of the world's children live in communities where either they have no access to devices or they have no access to the internet. And I think we have to acknowledge that these are the most vulnerable children of all, because they often come from families that actually have suffered the harshest results of the lockdown and other containment policies. So one example of actually addressing that is the fact that we now know that being outdoors, and luckily for us, the northern hemisphere is in the middle of its summer, being outdoors is extremely safe. If children are actually outdoors under a tree, as they did in the old days in India, you had your classes under a tree with your teacher, actually the risk is next to zero. So why can't we actually reimagine schools as not being in buildings that are closed with all the windows shut, but instead schools being out in parks where kids can actually meet under a tree with other kids and their teacher in a zero risk environment, but also one in which all the functions of the school are being fulfilled.
Guess I want to share with you a PSA COVID series that was made available for children in different languages in Nigeria, and it became a viral hit. So it was free. It was in multiple languages, and it was the story of Habib and Funke. There's an episode 1 and there's an episode 2. Episode 2 is so relevant to what is happening right now around the world. I'm going to hand over to Funke and Habib, and here's a little excerpt. Let's take a look.
Where are you going, Dad?
You see, my dear, the lockdown is over and
I know that, but where is your face mask?
my what?
And your hand sanitizer?
Sonny. Oh, the coronavirus. You see, I am a big chief and I cannot be seen in public looking like a
Habib!
I happen to know kids around the world love that video. They love the PSA. They love the fact that the kids are in charge and they're tackling some really big issues. Let me go to Fatima. I'm just wondering about the power of storytelling and mental health with kids. How does it help?
So it's funny that you were saying that the children, feel empowered by watching that. The premise of my book is also to empower children. The doctors that come down, they're superheroes, but they're asking the children to be a part of their team and to empower them to feel that they can, fight this thing, fight this uncertainty, fight this virus. And I think that that's the beautiful part of storytelling. It's you can create an entire different world and create a story in which children can relate to. I think that it's very hard to relate to a disease, or especially if you're not getting the virus, right? A lot of these children aren't even personally affected on a physical level. So I think to be able to explain through imagery, through characters that they can relate to, really helps.
Vikram, I'm just wondering with the various governments around the world, if you're seeing enough action for youngsters. There's been a lot of information about what we should do as adults, how we should act and social distance and mask wearing, etc. But mental health, are we being looked after for mental health? And then mental health for little ones too.
Yeah, well, let me just respond to what Fatima said about storytelling. I think it's a very powerful medium. And I hope that Fatima may respond to this later on. To what extent some of that storytelling is done by children about their own mental health. For me, one of the most powerful ways of busting the stigma, the shame around talking about mental health is talking about your own mental health. I had a really difficult day today where my parents had a big argument and I couldn't sleep at night, and how I managed to deal with that. So I think, that's a very important part of storytelling, is telling your own story. But the issue about you asked me about how are policymakers responding to children's mental health, the honest truth is very, very poorly. From what I can make out, there's a lot of talk right now, but there's almost very little action. And if you had to ask me what would be the most important action we need, is to start returning to school in a manner that is both safe for the broader community, but also recognize that schools are fundamentally important places for the well-being of children. And secondly, to support parents who are struggling with many of the different consequences of the pandemic in providing nurturing environments in their homes for their kids.
I have a question here from Marusa Alam. Marusa, hi, thanks for being on YouTube. Marusa says, what do you think about schools being open 2 days a week and then getting cleaned midweek? There's big conversations happening around the globe about, is it safe for kids to go back to school? I know this is a pretty general question to ask you, Jacqueline, but what is your viewpoint about kids in school in a global pandemic?
Yes, I totally agree with what Wickham said, is that the children should actually go back to the school. We understand that this whole pandemic has turned, it will become a new normal. Like we would have to deal with the virus for quite some time until the vaccine is all developed, and then we will actually see kind of the cases dropping and reducing all around the world. So the kids should actually be able to give them the opportunity to go back to school, because they have only one single chance to be in the school and during certain time of their age. But then the school and the government should actually conduct a lot of tests, maybe regular tests for COVID-19, to ensure everyone is safe, both the staff and the pupils. And then we can actually spread out the day, maybe like we turn it into like the working mode, like team A, team B, or even team C, for the kids to go back with a proper social distance. The 1 month that we actually went back to school, we follow very strict social distancing in the school. Everyone wear their masks, and we minimize actually any of the physical interaction. But I think a certain amount of time for the kids to be back into school, probably at least like 50% or so, is very, very critical, because otherwise it will really, really damage their mental health in the future.
While we're talking about school, I want to bring in Rebekah McIntyre. Rebekah is a kindergarten teacher, and she's worried about her youngsters. Let's have a listen to her.
Remote learning was a challenge. And I realized very quickly that challenge wasn't the academic piece. It was the social and emotional learning. And it was hard to listen to my parents tell me that these little 5 and 6-year-old children were sad. They missed their friends, they missed their teachers, they missed interacting. They needed to hear each other laugh and see each other smile. And we had to dig deep and figure that out. And I worry about them. I do. How will they get through this? What kind of year will they have? But what I know is that kids are resilient. And if parents and teachers work hard together and support each other, we can get through it. And I think the kids will be okay for that.
Vikram, go ahead.
Yeah, I completely agree with that. I agree with both the points that are being made there. The first point is that stress in children's lives, in this particular instance, not being in school and not understanding fully why, is profoundly damaging to their well-being. And let me tell you one thing, this is the most sensitive period in the life course in terms of the responsiveness of the brain to the environment. And some of the damage that we might see at this stage in life might actually continue to affect children all the way through into adulthood. But on the other hand, if we show solidarity, if we work with children as active partners, and we try and return to normal as soon as possible with all the natural sort of protections for risk, children are also tremendously resilient. In the same way that the brain is very exquisitely sensitive to stress, it also is resilient to recovery.
One of the reasons that we wanted to do this show, in fact, the main reason, was because of an author called Nathi Ngubane. He is from South Africa, and he wrote a book called Dumas Says. And it was really important for him that for the kids in South Africa, they had some literature, a story that related to their lives under the global pandemic. Let's have a listen to what he told us earlier.
The coronavirus has really affected how we live, socialize, and interact with each other. Because this virus directly impacts those living in cramped housing, I wanted to tell a story.
I'm just going to show you some of the pictures from the story. Let me just show you the beautiful pictures here. And what was important for this story, Dumas Says, was the kids could see their own lives. Although the global pandemic was turning their lives upside down, they could see their own lives right there. I am thinking, if you're a parent right now, Vikram and Jacqueline, what piece of advice, or a teacher, or an educator, or somebody who lives with kids, what piece of advice would you give them? And we're talking about little ones up to maybe age 5 or 6. In a sentence, Jacqueline, go ahead.
I would say that try your best to show them the love and the care, and tell them it's okay if the world is actually in isolation, and then you should just be yourself, be happy. So I guess don't worry too much about the academic or the other kind of development about the kids. At this moment, the mental health and the happiness is really the most important thing.
All right, very good. Vikram, one piece of advice in a sentence. Go ahead.
In a sentence, simply acknowledge that they exist. Don't treat them as if they're invisible. Don't treat them as young adults. Don't treat them as if they don't understand what's going on or can work it out for themselves. Tell them and ask them how they feel, and acknowledge their experiences and feelings in a non-judgmental way.
Fatima, go ahead.
I think the biggest thing that I would say is to communicate. Children are incredibly perceptive. They know something is up. They know that their lives have changed. I think the biggest thing to mitigate anxiety of any sort is to communicate, and sometimes over communicate, and really just pay attention to your children's feelings.
Thank you so much. Let's find out what Peppa Pig would say. Peppa?
Wash your hands as you sing along with Pepper.
Wash, wash, wash your hands.
Wash them nice and clean.
Bubbly, scrubbly, scrubbly, bubbly. Wash them nice and clean.
You need to
Wash our hands.
That's right.
Wash, wash, wash your hands. Wash them nice and clean. Bubbly, scrubbly, scrubbly, bubbly. Wash them nice and clean.
Remember to wash your hands for at least 40 seconds.
Thank you, guests. Thank you, Pepper. Thank you, YouTubers. I'll see you next time. Take care.